Hello, wonderful ladies of Mission Shakti. A very warm welcome to you all on another exciting episode of Mission Shakti Talk Series. As you all know, I'm Shweta Chandani. I'm the training lead for For Life India. And today we are here for the talk show Beyond the Basics, Unraveling the Complexities of Women's Health and Wellness. And for today's session, we have a very special guest with us, Dr. Swapnanjali Awath, who is a highly esteemed expert in women's health and wellness. She is a gynecologist by profession and has demonstrated remarkable dedication and hard work in her profession. With extensive experience in gynecology, she excels in various aspects of women's health, including pregnancy yoga, normal deliveries, labor exercises, gynecological surgeries, as well as laparoscopic surgeries. Dr. Awad's passion for women's health extends beyond the professional life as she has actively contributed in the Society for Garbh Sanskar and Child Brain Stimulation activity classes for women empowerment for pregnant females and their children. Her leadership and commitment is evident through her significant role in Indian Medical Association as well. So today she is here with us to share her valuable insights on the topic of women's health, and our special focus will be on urinary tract health and hormone health in female. Welcome, doctor, to the talk show.
Thank you, dear. Thank you, Shweta. It's a pleasure to be here.
Okay, so ma'am, today we are delving into the crucial topic concerning women's health, especially focusing on the urinary tract health. So before, going directly to the topic, let's start by discussing the prevalence of these issues among women, especially in India.
Okay. See, I'm so glad that you have chosen this topic because day in and out in my OPD, we see so many patients suffering from urinary tract infections. Now, worldwide, we have seen that almost 50 to 60% women, they face urinary tract infections some or the other time in their life. And almost 20 to 30% of these women, they suffer from recurrent urinary tract infections. So it's a major cause of lifestyle changes in a woman and the way a woman suffers in her life. So I think this is a very crucial thing. We need to discuss it more and try to know more solutions for this problem.
Yes. And the numbers that you have shared are, really significant numbers. They are very prominent numbers, and 50 to 60% of women. That means I think it's a very, very big ratio when you look at the population. So, doctor, what are the common symptoms of UTIs?
Commonly we do see that most of the times the first symptom that comes is the persistent and strong urge to pass urine. Now this urge is so like it's kind of an urgent urge to pass urine. Sometimes like 50 to 60% of the cases they do have burning sensation while maturating. Then there's cloudy urine at times. Also has a very strong kind of a smell, a pungent smell that comes from the concentration when the concentration increases from the ammonia. It also they also do have like the feeling that the bladder hasn't completely um, uh, like the urine hasn't passed completely, the bladder is still containing some urine, and that feeling also is a very common one. Also sometimes when it becomes a bit chronic kind of or a severe kind of a urine infection, then we may see blood in urine as well. Also, there can be pain in the lower abdomen, which is excruciating pain. Sometimes it refers it again passes to the back as well, and in the like till the navel area. And also some of them they do have back low back pain as well as rigors, chills, a kind of rigor that passes from the lower back. So these are some symptoms. A feeling of cold also at times, which is a sudden kind of a feeling. Now, when these symptoms are seen, first thing that we diagnose is urinary tract infection. So it's that common, and these are the symptoms which are exclusively seen in urinary tract infections.
Okay. So, doctor, what are the major reasons which causes the UTIs?
Now, the most common bacteria that causes urinary tract infection is E. coli. Now, this bacteria, it enters through the urethra. Sometimes it is also because of the close relation of the anus and the vagina and the urinary meatus. That's the opening of the bladder. So these things, these anatomical positions makes a female more prone for UTI. Also, some of the reasons are holding urine for a very long time, dehydration, which causes concentration of urine. Also, poor vaginal hygiene. As I said, that vagina is in close proximation with the meatus. That also is one of the contributing factors. Sometimes it could be because of diabetes. It could be because of irregular bowel movements, like in loose motions, etc. Then also, like, after, it's very commonly seen after marriage, and that we call as honeymoon cystitis. So, this is because the couple has just started having intercourse, and this also gives rise to UTI. We'll also discuss more about that further. These are generally the causes that are responsible for UTI.
Okay, okay, okay. So basically, you should be well hydrated also, right?
Yes, yes.
Okay.
That's a very important point because that flushes out the organism even if it enters through the urethra.
And doctor, what about the hygiene products that we get in the market? Are they, effective enough for maintaining the good hygiene? Or is it completely fine to use the normal body wash?
No, this is a very good question because these days we find so many over-the-counter products that we can easily buy and use, and they are advertised in such a way that it's shown as a solution for all kind of vaginal and urinary infections. But sometimes, we don't advocate that, we don't promote that, only because these washes, when they are used extensively and daily, in fact, there are patients who use this so frequently, like 5 to 6 times daily. So these washes, they alter the pH of the vagina, and which is also bad for the normal bacteria that reside in the vagina. Nature has given us a natural antibiotic. It has given us natural bacteria which are very good for our vaginal health and for the urethral health. But then when we use these V wash, sorry, I won't mention the name of the product, but then sometimes, like, all these vaginal washes that we see in the market, they do deplete an amount of good bacteria present in that area. So that could also be one of the reasons. Another reason are the chemicals used in these. The chemical like sodium lauryl sulfate, which creates the foam in these products, that also irritates the sensitive inner lining of the vagina and the urethra. But we don't ask the patients to use these unless the risk outweigh the benefits of the product.
Okay, that means you mean to say that the over usage is bad, but if you're using it like once a day, it is fine, right?
It can be used during the periods because that time we need to really maintain the hygiene of the vagina. But then
Okay.
it need not be used regularly on a daily basis. That can be used only when you are already having an infection to
Okay.
cleanse the area, but not
Oh,
on a daily basis.
okay. I think it's a really good point to catch on. And doctor, who is at high risk of developing UTIs?
As I already told, the relationship of the vagina, the urethral meatus, and the anus. So, women are more prone to UTI than men because of a shorter urethra. Urethra is the duct, that is the passage joining the bladder, which is holding the urine, and the external area from where the urine is passed. So this urethra is shorter, that is somewhere approximately 4 centimeters in length. That's 3.75 centimeter in length in women. Whereas men, they do have a very longer urethra, so they are not that prone to UTIs. Also, like, other risk factors could be age related. Also, like, sometimes because of age, because of the day of the cycle, the pH of the vagina, it alters.
Okay.
So every day the pH changes, and so few days you become more prone to vaginal infections because the vaginal pH changes. Now, this hormonal changes, they do occur after menopause as well, in patients who have they have some voiding dysfunction. If they cannot void the urine properly, since the urine is retained more in the bladder for a very long time, that also could lead to UTIs. Then patients who have high and uncontrolled sugar levels, who are diabetic, also those who have frequent sexual activity and in which they don't pass the urine, they don't maintain hygiene. Then also uh, poor immunity is also one of the reasons, sometimes blockages because of urinary calculi or stones. So these things are generally the reasons which make them higher, uh, the increases the risk for developing UTI. So when we see these group of patients, also the pregnant women, now these, since the immunity is a bit lower, on a lower side, they are more prone to UTI. So everyone who falls in this group needs to maintain a vaginal hygiene at a very higher level and promptly than other patients. So I think this is a key factor in curbing UTI symptoms.
Okay, so doctor, as we spoke about the risk of developing the UTIs, can you tell us some of the key practices to prevent UTIs in people who frequently get, how can we prevent it?
Okay. Now, as we have already talked about the symptoms, also who are at a higher risk of developing UTI, so it becomes very easy to know how can we prevent UTI. Now, to prevent UTI, the first thing that has to be practiced is frequent urination. You need not hold urine for a very long time. You should empty the bladder frequently so that it doesn't get collected and doesn't invite more bacteria. Second important thing is to maintain the vaginal hygiene. Now, the hygiene of private part, if that is the reason, then definitely we need to maintain that. Maintaining the right amount of pH. To maintain the pH, we should avoid using all the chemicals and all the washes, vaginal washes that are available in the market. Then again, like as we talked about sexual activity, after the sexual activity, if the women, she empties her bladder, that reduces UTI by at least 30 to 40%. So again, this is a very important factor. Now, sometimes, the climate also plays a major role. Like if you live in a humid kind of a place, then you should wear clothes accordingly. You cannot wear jeans and leggings and these tight fitting clothes in an area where you have more kind of a humid or hot kind of a climate. So climate appropriate clothing is again very important. You should also choose contraceptives carefully. Now, sometimes, like when we use the contraceptive, like IUCDs are used, that those are intrauterine devices which are used as contraceptives. Now, these, they do have a thread that remains in the vagina. If the thread is long enough to come out of the vagina, that also invites bacteria directly. That gives a straight passage for the bacteria to go inside the vagina as well as the urethra. Then again, products, cosmetic products like talcum powder. Now these things, they've really banned these things in the Western countries. So
Okay.
anything that is not needed there should be avoided. Now, once we avoid all these things, I don't think there can be a case with frequent UTIs. So these practices, they generally prevent majority of the UTIs.
Okay. So is it okay to use the normal body wash, like, or normally whichever body wash you're using for the whole body, is it okay to just clean that area with the body wash, right?
You can use that, but then see to it that if you are using a soap, you need not rub the soap directly on the private parts. So
Okay.
you just can take the lather. You can just take the lather. You just first clean your private parts with plain water, a normal kind of a plain water. You need not use hot water or specifically cold water for that. So any normal water with a very neutral kind of a soap, which is not which doesn't have a very strong fragrance, because these are shower gels and these products that are used for bathing, they have a very strong kind of a fragrance. So these essences also dry out the lining of the vagina and the urethra. So anything that is mild, kind of a sensitive, and these things if you use, then definitely they won't harm your lining of the vagina and the urethra. These can be used, but again cautiously, just once a day is okay, so that whatever the damage is there, it can be recovered throughout the day.
Okay, okay. So, doctor, what are some of the dietary, supplements that you can, you suggest in your practice for urinary tract, for a better urinary tract health?
Okay. Now, this again is a very good question because being in India, the first thing that we are asked about is like, nuske bataiye aap. So, anything home remedies or something that is improved by diet is the first query.
Yeah.
So, generally, I would say that your food items should be very high on antioxidants. So,
Okay.
antioxidants which come from naturally from fruits. So, the intake of fruits has to be increased. Now, if we talk about specific dietary supplements, which actually help us elevate the UTIs and improve the health of the urinary tract, are like, for example, cranberry. Now, what cranberry extract does is it doesn't allow the E. coli bacteria to go and stick to the urinary tract lining. So, the inside layer of the urinary tract, if that is protected by cranberry extract, then the bacteria cannot go and stick there and then have their influence. So cranberry extract these days, it's very useful. You also like, if it's very difficult to get these cranberry extracts, then some like as I told you, berries, they help. And from the among the berries, cranberries are the best berries. Then
Okay.
again, like the supplement called as D-mannose. Now D-mannose is kind of a diuretic. Now diuretic increases the flow of the urine. It increases the amount of urine. So naturally, if there's a lining, if there's a duct which is not good, which contains bacteria, then you need something to flush it out.
Yes.
And the D-mannose, it does the same thing. It flushes out whatever bacteria, whatever harmful chemicals they are present in the tract. Again, very important thing is probiotics. Now, why probiotics? Because as I said, the good bacteria that are present over there, they are the natural healers.
Mhm.
They are the natural protectors of the lining. Now, if you frequently use soaps or body wash or vaginal wash, these chemicals, they deplete your natural
Practice.
bacteria which are present over there. So, to bring them back in the tract and to help your body fight the infection properly, you need probiotics. So these are again very important thing. Again, an important factor, like important supplement, is vitamin C. So commonly available, but we don't appreciate things which are commonly present in our food
Exactly.
items. That's the reason why we need to take supplements for vitamin C.
Yeah.
So when we take vitamin C supplements, the inner lining, the wear and tear of the inner lining, that happens smoothly. So these supplements, what I talked about is like cranberry extract or D-mannose or probiotics or vitamin C. They actually directly improve the health of the urethral lining, and because of this, the whole tract, it becomes healthy. And even if there is a significant amount of bacteria, they don't get access to the tract. So these
Okay.
are very important.
Okay, so the interesting thing here is we in For Life also have an exceptional supplement. The name of the product is For Life's KBU, and it has all the ingredients that you mentioned. So basically, it has D-mannose in it, it has cranberry fruit extract in it, and a lot of other ingredients. So basically, if you look at it, the product, it has, bladder cleansing ingredients. So it has cranberry, it has blueberries, it has D-mannose, which promote the overall bladder health and also the urinary tract health. The best part about D-mannose is that it is said that it cannot be ingested by humans. So within 30 minutes you take it, your body is going to take it off, and it is going to flush off the bacteria that are there. So it is a very well-researched ingredient when it comes to, flushing off the bacteria, especially the E. coli that you spoke about is a very commonly seen bacteria when it comes to urinary tract infections or the for the urinary tract health. It is D-mannose is one of the beautiful ingredients that we have. And in this product, we have the product name is For Life's KBU. Apart from this, it is really good for the healthy kidney and urinary tract health because it has dandelion leaf, it has juniper berries, it has varuna, it has inositol in it. So by combining all these powerful ingredients, KBU is something which ensures, as the name suggests, KBU, it is for the kidney, bladder, and the urinary tract health. So it is going to prevent your urinary tract from a lot of unwanted microorganisms. And the best part is it has transfer factor, trifactor formula in it, which are these proteins and peptides from cow colostrum and chicken egg yolk, which are going to balance and enhance your immune system. And these are basically well-researched ingredients which help in activating your immune system cells. So your immune system is better able to recognize, respond, or remember any threat. So basically, blueberries, if you see, these are very good for reducing the inflammation. D-mannose is something which flushes out the unfriendly bacteria. Dandelion leaf supports liver function, and in turn, it is a very detoxifying ingredient for the kidney, bladder, and the urinary tract. Juniper berry, as you said, it has diuretic properties also. And Varuna is something which brings down the inflammation. So all of these ingredients combined in a product, it is like a well-rounded approach, can be taken by males and females both. So how do you think about this product?
Really good. I'm so happy that everything comes in just one product.
Yeah.
And it really looks like a promising product, because usually what happens is when we prescribe something, we need to give all these supplements separately. And
Yes.
it's very difficult to convince someone to take 2 or 3 medicines just for the same problem. So
Yeah.
definitely, I really like this product, and so happy that everything comes in a single package. So
Yeah.
it's really good. Good.
Thank you, doctor. And the best part is this comes from the targeted range of products that we have. And the targeted range, the beauty of that range is we have the USP molecule in it, which is the trifactor formula, the star ingredient in all of our products. Then the targeted range is something which target on the entire organ system. So, like for example, when you speak about urinary tract, so this product is something which will focus on the kidney, bladder, urinary tract. Apart from this, a lot of botanical extract and well-researched ingredients to help you support the system. And doctor, as you mentioned about probiotics, so we also have a product named as prebiotic in our product range, which has probiotics and prebiotics along with transfer factor molecule. So it is going to give your microflora good and healthy, good and healthy good bacteria to the microflora. Apart from this, it also has immunity, enhancing molecules, which are transfer factor, and the ingredient is transfer factor, trifactor formula from cow colostrum and chicken egg yolk. So this is a very well-researched ingredient, and it is said that it enhances, balances, and boosts your immune system as well. So prebiotics is a wonderful product. It has probiotics, that means the beneficial bacteria. It has prebiotics, that means the food for these bacteria, and it has transfer factors in it. Comes in a microbeadlet technology, that means the product directly delivers to the colon. Best part is this product has 2 researches on it, which says that because of the microbeadlet technology, the product directly goes to the colon, and it is 1,000 times more effective than the other standard technologies by which the product is made. And apart from this, because of the presence of transfer factor in it, the healthy bacteria growth is stimulated up to 868%. So these are the 2 researches that has been done on these products, and which makes this product more impactful when we speak about this product to people. Product also has really good results. So this is for entire gut health, can be taken by females and males both, and a wonderful product for your gut health.
That's so nice, since you have such detailed knowledge about all the ingredients, how it works, and so this confidence comes from the effect of the medicines. I'm sure it must be a wonder drug. So I'm so happy
So
that we are
doctor,
talking
it's
about
basically it's not a drug. These are supplements. So supplements,
supplements.
basically, as we all know, basically these are extracted from the. So we have food supplements with us.
Okay, that's great.
Yes.
Yeah.
So let's move on to another part of this show. Where we are going to dwell deeper into the hormones. So hormonal imbalance in India is a major problem. So what do you think? What are the major causes for hormonal imbalances that we see in India today?
Hormonal imbalance, definitely it's very prevalent among women. Now, millions of women worldwide suffer from all these problems. Somewhere I feel that this generation, like in India, if we talk about the developing countries, this is the generation which is actually going out seeking jobs, working, and playing a dual role in their life. So when it comes to the previous generation, when they used to be at home, they used to have access to the to all the comforts, and because of that it was very easy. It was like they had good sleep, they had good diet, they had good access for all the when we talk about we already talked about the urinary tract infections. So being at home, it was very easy to deal with that. But these days, since we are working, since we have more of stress, we don't have a regular kind of a lifestyle. We are multitaskers. Even environmental factors also play an important role. Since there are people who have throughout their life, they have stayed in one, maybe for example in North India, and then because of a job they shift to the South India. So these things definitely play a role in the hormonal imbalance. So also medical conditions. Now these days we are seeing so many patients with diabetes, with hypertension, with endocrine problems. So these do alter the hormones, and so definitely, as we already talk about, we always talk about stress and lifestyle habits. But these are the only, these contribute only to 50 to 60% of the problems. The other things that we discussed, they also play an important role. So they do lead to hormonal imbalance.
So dietary changes, lot of,
Let
lifestyle changes and everything contributes to this. Okay. So, can you elaborate on some of the common causes of hormonal imbalances that we see today?
These days, we are seeing so many patients with polycystic ovarian syndrome. Now, this has become a disease, I would say, on it in its own. We At least half of the hormonal imbalances, they consist of PCOS these days. Then again, thyroid problems, thyroid disorders, menopause, pregnancy. As in pregnancy, also the hormones, they do change. Then certain medications also these days, they do alter the hormones. Then stress again, poor diet or an imbalanced diet. We don't have time for exercise. When the sleep is inadequate, and sometimes, as I said, that the climate and also the environmental conditions, these also are the common causes of hormonal imbalances in women.
Okay, so what are the signs and symptoms that a woman should look out for to identify the hormonal imbalances, and what is the time when it is the time to consult a doctor? So, where you should go out and seek help.
Okay. Now this is an interesting question. In women, we have periods. Periods are the best sensors.
Okay.
Women, if her health is good, her periods are regular and everything is fine. But if she has even the slightest of imbalance, slightest of problem, the first thing that's going to change are her periods. So the periods, if they become irregular, if the menses, they become scanty or they become heavy or frequent, or they are prolonged menses and all these things. So any changes in her periods, then her mood swings, like if she has started noticing, or if the family has started noticing that the mood swings are quite often these days, so that is also a specific sign. Then sometimes the weight also fluctuates. Even a female, she does experience fatigue, weakness, like her what you call as uh, the kind of work that she was comfortable doing with, now she's not able to do that amount of work. So this way her stamina decreases. We can also see acne, hair loss, or the changes in libido. Now this is also one of the most important factors in a married woman. So all these are the common signs and symptoms when a woman, she actually needs to consult a gynecologist to tackle all the problems that she is facing.
Okay. And so basically, we should look out for the menstrual cycle. So if the menstrual cycle is smooth and as per the it has been throughout your life, then it's fine. If you see any changes in the menstrual cycle, then it is definitely to the time to go to the gynecologist, right?
Definitely.
Yes. And like for general gynecologic checkups, how many times in a year a female should go for regular checkups, like just casual, going for a casual checkup? What do you think? Like once in a year, twice in a year, thrice in a year. What do you recommend?
I recommend coming twice a year, at
Mm.
least twice in a year, because every like 6 months is a quite significant time to notice any kind of a change. Like I won't recommend once in 3 months or 2 months, because it's right here and there. As I said, the periods there are the most sensitive uh, cycle that is going on in the body. So even an exam can alter a period for 1 or 2 months.
Yes,
So that
exactly.
is not like you need not see a doctor for that. So
Yeah.
at least give a significant amount of time, that is 6 months, to observe yourself, to notice what kind of changes you're having, and then you can consult a doctor. And in these 6 months, I also recommend some other test investigations as well to detect other diseases, other illnesses as well. Like when we talk about diabetes and hypertension, so these things should be checked, because
Okay.
women, they do come to us like when they come for a surgery, and we test them for all the like we do the
Other parameters.
pre-operative fitness and all. That time we get to know, okay, she is also suffering from diabetes and hypertension. So I think once in 6 months is like is the time when you need to visit your gynecologist on a regular basis.
So I've also heard some people what they do is they get their checkup done on their birthdays and anniversaries. So I think it's a
Yes,
good time to gift yourself the gift of health. So
exactly.
especially in this generation where we have a lot of work burden, lot of stress, low amount of physical activity, bad eating habits. So a lot of this in combination, I think lead to a lot of hormonal challenges. And the worst part is आपको तब पता चलता है जब आप बहुत ज्यादा स्टेज पे आ जाते हो, मतलब व्हेन यू आर एट अ सीवियर कंडीशन, जब आप चेकअप करवाने जाते हो तो आपको पता चलता है कि ये भी है वो भी है. सो स्पेशली ये सिचुएशन पे नहीं आओ आप, उसके लिए इट इज बेटर दैट एटलीस्ट आई थिंक 2 times a year as you mentioned is a good time. So for the audience also, 2 times a year as doctor mentioned is a really good time to get all your checkups done, get all your reports and parameters checked on lifestyle related health challenges, hormonal health, everything, right?
Yes.
Okay. So, doctor, let's
That's the
move
least
on
that
to
we
the
can do for ourselves.
yeah.
That's the least that we can do for ourselves. I think women, when we are multitasking, we should be in the pink of our health, because if they, she is the most important person in the family, that actually who actually is plays a pivotal role in the health of the whole family. So her
Exactly.
health definitely has to be the best.
Yes, yes, definitely. Because when you have enough, then you are a better giver, right? So अगर
Yes.
आपकी हेल्थ अच्छी है तब आप दूसरों को अच्छी हेल्थ दे सकते हैं. So it is very important to take care and optimize your health first so that you can take care of your family's health in a better way. So doctor, let's
Yes.
move on to another question, which is about the dietary supplements and how they can manage hormonal imbalances in women. There are a lot of proven supplements in the research and science today which say that some of the supplements can help manage hormonal imbalances. So, can you name some of them and what do you suggest in your practice?
Now, commonly what I recommend is like having omega-3 fatty acids, because that's kind of a raw material for the hormones.
Exactly.
So these omega-3 fatty acids can be taken on a regular basis. You can have magnesium. Now, magnesium, it plays a role in the in changing the diameter of the blood vessels. So
Okay.
if you have enough of magnesium, the elasticity of your blood vessels is maintained. So
Okay.
if the elasticity is good, you won't be having problems related to the blood pressure. So
Oh,
magnesium is also important. Vitamin D also plays an important role. And herbal supplements like Shatavari. Now we do have herbal supplements which work wonders specifically in women.
hmm.
So one of them is Shatavari. Now it has so many benefits, right from nursing, from the pregnancy period to the nursing period to the menopausal period. So in every age group, Shatavari also plays a very good role. So also we do have red clover, then we have phytoestrogenic activity products. Like we have soybeans, which are good in phytoestrogens. We have arbi, we have this suran and all. So these
Okay.
vegetables, they are good in phytoestrogens, but it's
Phytoestrogens,
not
yeah.
feasible to eat them daily. So what least we can do is we can have these supplements directly in the right amount, right proportion to have a healthy hormonal balance in your body.
Okay, wonderful. So, Doctor, we also have a supplement named Belevi, which is a wonderful supplement. It has shatavari in it, it has kudzu in it, it has red clover. It has a wonderful blend of ingredients which are phytoestrogens, which mimic the natural estrogen in the body. So as we all know, जैसे जैसे age बढ़ती है तो estrogen कम होता जाता है. And as you told that shatavari is a ingredient which can be used at every age. So this product is also something which has phytoestrogens in it, and it has transfer factors in it. So it is going to balance your immunity. And apart from that, it is also going to act as a natural estrogen in the body, which is a very important hormone for having your good gynecologic, good breast health, and also for your regular menstrual cycles, which is a very, very healthy aspect for a woman's health. So this is a product named Belevi, also really good for the fertility as well because of the presence of shatavari and other ingredients in it. And you also told about omega fatty acids, and yes, I also definitely agree. And research also say that omega fatty acids, or the fatty acids that are there in the supplements, they are like the starting point for making the hormones, and also very healthy for your cells. So when you're feeding your cells with healthy oils or healthy fats, सेल्स बनते हैं एक्टिव. और अगर आप बहुत ज्यादा प्रोसेस पैकेज और जंक फूड खा रहे हो, so your cells also become sluggish, they could become weak, and then hormonal imbalances. So I think omega fatty acids are some of the best supplements for your skin, hair, nails, as well as heart health and gynecologic health as well. So, then we also spoke about vitamin D and magnesium. So we also have vitamin D and magnesium with us in a product named Vitamin and Mineral Complex. So it is 13 vitamins, 14 minerals in one pack solution. For omega fatty acids, we have essential fatty acid complex. So I think these are some of the amazing, supplements that every woman should include in their diet. Now, when you look at the range of products that we have, so we have targeted range, we have health, everyday health products. We also have specified, core category of products for immunity as well. So these are the different range of product that we have. So besides from the supplements, doctor, what do you suggest? What are the lifestyle habits or dietary changes that women should incorporate to help balance their hormones?
Now, when we talk about a healthy life, I always prioritize eating healthy, eating the right food first. Now, the first thing that we need to do is eat healthy. Second thing is drink enough of water. Third thing is have adequate amount of sleep. Fourth thing, which regularizes your hormones, is regular exercise.
Yeah.
Exercise also generates and secretes endorphins, which is a happy hormone. Also, like when we talk about like eating right, now that means that you should have right proportion of carbs. You should have good amount of fruits, which has antioxidants. You should have a good amount of proteins, which are lean proteins. Now these and healthy fats in your food. So you can't
Yes.
just avoid completely fats. You need to have healthy fats in your food. So when we have these things in the right amount, that is the right kind of diet you should follow. So have a balanced diet. Think positively. You need whenever you have stress, you can just sort things out only when you have the right amount of food, because that food will help your brain think in a better way and find more solutions for your other problems. So, and definitely a working woman, she needs to prioritize diet, a healthy diet. The maximum, that is the least she can do for her profession, I would say. and having adequate amount of sleep. Now, sleep, you won't call sleep a good sleep only because you sleep for 10 hours or 8 hours. It should be sound sleep and in those hours, because sleeping in the right time, in the right amount, that is very important. You should always follow the day and night cycle, because that
Circadian
gives the
rhythm.
best kind of sleep. So all these things taken together, followed regularly and consistently with great determination, I think that would be the best message I can give today on this platform. If these things are followed, no women will have any kind of hormonal imbalance or any problem or urinary tract infection or other diseases. So
Yeah.
these things should be followed. And I really thank you for coming up with all these nice topics or with all this information, because this again shows how much we are concerned about women health, of the health of the whole family as a whole. So thank you, dear.
Thank you very much, doctor. I think it was a very holistic message, which, included all the takeaway message. It was very holistic takeaway message, which includes good diet, good exercise, keeping away, the stress and being positive. So I think all of these in togetherness, they work to have a healthy and a happy life, right? So thank you very much, doctor. And it was lovely interacting with you. And we hope to have you in more sessions in future. And thank you very much for your time.
Thank you, dear. Thank you.
Thank you very much once again.